Amita, co-founder of Nourish Talk, a platform for natural and holistic medicine. We bring educational sessions every week to show efficacy of natural and integrative medicine. In our educational session today, we are going to talk about how Ayurveda can help you with effective pain management. Presenting this topic, we have Dr. Dhanvantri Jha from India. He is a medical doctor. He is an Ayurveda MD and a PhD scholar. Well, welcome Dr. Dhanvantri to our show.
Namaste. Thank you, Amitaji, for inviting me for this session. Good morning to all our friends in US, and good evening to all our friends in India, and also good afternoon to people in Europe, basically.
Well, thank you. Welcome. Well, I also want to mention Dr. Jha is an international speaker as well as a researcher. So we don't have so much time to talk, but we will go right into our webinar. Dr. Jha, could we start off overall with pain? What exactly is pain?
Basically, we have to understand that pain is something which is very important to each and every one of our lives. It is one of the most important symptoms which takes us to a doctor, basically. Mostly we see that if you don't have pain, you won't go to a doctor, right? Most of the cases, pain is the first and the only symptom which takes a person to a doctor or a physical practitioner or some kind of a therapist. According to the International Association for Study of Pain, it is basically a sensory and emotional experience which a person manages or a person feels when he has some kind of a tissue damage or a potential tissue damage, or many of the times when he's affected emotionally as well. It is very unpleasant. We all know that the smallest of the pain in our body can lead to huge amount of discomfort, won't allow us to do anything in our day-to-day life, in our routine life, according to our schedules, right? So it has both physical and emotional components. Can we move on to the next slide, please? Yes. Pain as the main symptom can be seen in many of the diseases like osteoarthritis, rheumatoid arthritis, many types of cancers, migraines, cervical spondylosis, appendicitis, renal calculi or kidney stones, what we know as disc prolapse, and many other things. But what we have to understand here is this is not the only symptom of the whole disease. But we are talking more about pain, or why people talk only about pain is because they feel that, okay, even if this pain is gone, I can live my life happily and without any problems. Pain sometimes can be very severe, very sharp, and cannot be tolerated. Sometimes it is like, okay, since many years or since many weeks or since many months, I have some kind of a pain, but I don't have any option because nothing works on me, no medicine works on me. So I have to tolerate it. Whatever may be the intensity of the pain, but it is basically suggestive of something going inside the body. Maybe some pathology, maybe some disease in your body, which is causing that pain. So ignoring the pain or just suppressing the pain with a painkiller can be very harmful in a long run to you. But as we know that intensity can vary from each and every person. Like some people may be absolutely fine with similar type of pain, but with a similar type of pain, some people may be like even crying or even they go into anxiety or depression because of the similar intensity of pain. I have a picture lined up next, where you can understand that how pain can affect different people in different ways. Yes, you can see here that the person has piercings all around his face. This is most probably someone who has the Guinness Books of World Record for piercing his face at present. And we cannot even imagine bearing such kind of pain. But that person is absolutely fine, looks okay with the pain that he has gone through. And you can just imagine how can they go into such pain. Similarly, a female, when they give birth to a child, they the intensity of that pain is, if you have a pain scale of 10, it is even more than that. While a male cannot even think of having or bearing such kind of a pain. So it is always the situation, it is always the person, and it is always your mental strength. According to Ayurveda, we call it as the sattva bal, or your strength, your inner strength, which gives you that tolerability to adjust with pain.
I was going to comment that I didn't realize that childbirth is pain, more than pain level of 10.
Yes, it is. It is. It is the most painful event in the whole world, basically. And thanks to our mothers, basically, because that is the amount of pain they feel. And then sometimes when people say that, oh, females can't tolerate, then I feel like, oh, in which world are you living?
That's right. That's right. So let's talk about how Ayurveda classifies pain.
Basically, the few basic things about Ayurveda is a tridosha based theory, is the three humors of the body: the Vata, the Pitta, and the Kapha. If I had to simplify these, the Vata is basically something which is composed of space plus air. That is the lightest of the five elements of the world, out of which the whole universe is made. When I say space, it is not limited to a hollow space, but it is something which can attract, or which has the capacity to fill. Then there is air. Air basically here means anything which has movements. So this is the Vata dosha. Then we have the Pitta dosha. It can signify metabolism. It can signify your fire. It can signify the heat in your life. And then the third humor of the body, or the third dosha of the body, is the Kapha dosha. The Kapha dosha is made up of the heaviest of these five elements, out of which the whole universe is made. It is the water and the earth. But when I say water, it is not just simply the water or H2O. It is basically any kind of fluid. And the earth, which doesn't only represent the earth, but it represents anything which is solid and anything which is heavy or which has some form. So these are the three doshas of the body, and Ayurveda generally classifies everything into these three. Now, every dosha has a particular symptom attached to it. Like the Kapha dosha has heaviness attached to it and itching sensation. If you have itching in your body, you can understand there is somewhere disturbance of the Kapha dosha. If you have burning in your body, or if you have heat sensation in your body, or you have excess anger or irritability, you can understand that is because of your Pitta dosha disturbance. And then comes our point, that is the pain. Pain is always associated to the Vata dosha. The Vata dosha, which is comprises of the space and air, or ether and air, you can say. According to Ayurveda, there are a lot of words. We use Sanskrit, and Sanskrit, you know, is a beautiful language. With a single word, you can amplify or mean a lot of meanings. And so pain, according to Ayurveda, has many names: Ruk, Ruja, Vedana, Shul, and different kinds of pain depending on the intensity and depending on the conditions. But at present, if we want to talk about generalized pain, we can say Shul is one of the appropriate terms for it. And Vata dosha is the main causative factor which will cause pain in your body. But as you know, we always say that Ayurveda is a holistic system of medicine. So when I say I have to treat pain, I have to concentrate on Vata dosha. And you will always experience that when your Vata dosha is disturbed, it will cause pain, obviously, yes. But along with that, it is going to cause constipation. It is a symbol of some kind of denourishment in your body, or malnourishment, what we say. You may have dryness in your body. Your skin may be extremely dry. You need to apply a lot of moisturizers. You have roughness in your body, roughness in your voice. You may be suffering from hard stools or constipation. So when we say we treat pain in Ayurveda, we actually treat the Vata dosha, and along with that, we treat all the associated symptoms as well.
So let's talk about foods, the diet. As you know, Ayurveda treats diet as one of the constituents.
Yes. Exactly. So the basic thing is, as I said, that we have a holistic approach towards everything. Even in diagnosis, as I told you, that when we diagnose pain, we also diagnose other symptoms. We see other symptoms, and we see if there are certain other associated doshas into this. As I said, like Vata Dosha will create pain, obviously, yes. But sometimes you also may have burning sensation along with it. So then you have to take care of the Vata and the Pitta Dosha as well, right? The fire and the air, both. So then you have to select treatments in accordance to that. Now, when we talk about generally about pain and the food or the diet, the first thing Ayurveda says is to avoid the causative factors to treat anything. And so it also mostly we see in our practice, in our day-to-day practice, that most of the people have some or the other habit of having some kind or other kind of food stuff which are going to increase the intensity of their pain, or which are the reason for their pain. So the most common things that you have to avoid is anything which is astringent, pungent, and bitter in taste. You have to avoid these three tastes if you want to reduce your pain, or if you are suffering from chronic pain. You have to avoid anything which is cold and dry, because they are very similar to the properties of Vata, and it will be increased through these, and the pain will increase. Then cold water, sodas, cold drinks, what we call in India, such kind of things, or refrigerated foods, because most of the modern society people, they don't have time enough to cook fresh. So what they do is take the refrigerated food, directly cook, and then eat. Then the stale food, the leftovers from last night, eating in the morning, or in the morning eating in the evening, or what we see in Northern America, that people cook for 7 days a week on one day, and then keep it refrigerated, and then just reheat and eat. Such kind of food, raw foods, salads, dry fruits and salads, basically, this is one of the very important things which we should always talk about, because the modern human being believes that to remain healthy, you have to eat raw, or you have to eat a lot of salads. But actually, this is not doing any good to you. It is actually harming your body. Yes, it may be good in certain conditions where you need to control your nourishment or overnourishment, but in conditions of pain, always avoid these. Avoid heavy foods which are heavy for digestion, because that again hampers one of the important factors according to Ayurveda, which is Agni, or your digestive fire, you may say. Then take only lukewarm water to drink. Take hot foods, fresh foods, hot drinks. By hot drinks, I don't mean the caffeinated products or alcohol, but warm milk or warm water, or warm normal temperature juices. Apply heat to the area of pain. Generally, according to many things, many inflammatory conditions, many people apply cold packs, but in a long run, that is going to cause degeneration, and that is going to cause more pain. So instead, apply hot things to the area of pain. Relax, take rest, because Vata is something which will excite you. So what you need to do is, you just need to relax, take rest, and that will help you pacify your Vata dosha. Spend some time thinking about good things, because then you are controlling yourself. Vata dosha is something which will increase when you think a lot, when you are worried, when you are in fear. So think about good things. Eat enough food. Enough nourishment is required. Don't stay hungry, or don't skip any meals if you have pain. Drink enough water. But there's a catch into the saying that when I said don't stay hungry. Can you move on to the next slide, please?
Sure.
Yes. There is a concept in Ayurveda known as undigested food, or some kind of a poison, basically, which is caused due to indigestion in your body. That is the concept of many doctors say that ama is the mama of all diseases. So this arm is very important. Now, if you have pain, then one of the simple things, there are a lot of things through which you can check your arm levels. But one of the simple things is, you can see in the picture, the tongue, your tongue will be coated white. If you have coated white tongue and then you have pain, that means your pain is not only pure vata, but it is associated with your metabolism as well. And so during such times, you have to and you can skip your meals, because that means the first thing you need to do is you need to control your nourishment, you need to control your ama, you need to improve your digestion and then treat your pain. But automatically, when you control this, your pain will also be treated. So sometimes fasting may also be the treatment for treating your pain. But you have to differentiate if it is with arm or if it is without arm.
So let's go over the therapies, how we can, how Ayurveda can help.
See, the basic thing which we saw was the diet and lifestyle, what we have to do. Yes, in lifestyle, if I have to add, I can say reduce your exercises, reduce your physical work. Because when you do excessive physical work, your Vata increases and that increases your pain. But then if you have arm, you can do your exercises or your physical workout. Now, after this, we have internal medications, other things. Then, according to Ayurveda, we have a specialized Ayurvedic treatment, which is known as the Panchkarma therapies, the purificatory therapies. In that, we have a lot of procedures which can be used safely in certain conditions. And so, for your pain, if you have pure Vata, again, the thing would be you should not have your arm in excess. If you have your arm in control, what you can do is the Ayurvedic Abhyanga treatment. This Abhyanga treatment is basically using any warm medicated oil or simple oils like oil or mustard oil, such kind of oils, depending on your body personality, what we call as Prakriti in Ayurveda. You can use Abhyanga. Abhyanga is a procedure where you do body massage with heated warm oils. But the thing is, you should not heat the oil directly. You can use a water bath to heat the oil indirectly. And then this Abhyanga helps you to reduce your Vata, and thus it will also help you reduce your pain as well. We move on to the next therapy, that is the Svedana or the steam therapy or your sudation. What you can do is, we generally don't advise anyone to go for directly for steam. We always advise the Abhyanga and Svedana to be done together. So first you go for Abhyanga and then you have steam or sudation therapy or the spa treatment. You can go to a simple spa as well. You can have a steam chamber for yourself. That will also help you reduce pain. But in conditions of arm, when you cannot do Abhyanga, during that time you can directly apply Svedana or fomentation or heat therapy. But for that, you will have to use different kind of things. This heat again, or the Svedana or the fomentation again, is a different kind of therapy which will reduce your Vata dosha. But for people who easily have heat generated into their body, or problems like hyperthyroidism or problems like burning in their body, then this therapy should be reduced to minimum of time, because this can increase a lot of circulation and lot of heat in your body. So this is also one of the very good treatments for pain. It can be done in localized way and in a generalized way as well. Then one of the most important treatments for Vata dosha is the Basti Chikitsa. Now, there are different things for this Basti. There are two words basically. The Basti here means two basic things. One is the normal enema. In this, we have different kind of oils, decoctions, honey, herbs, herbal paste, all mixed together. And this as a whole liquid is given into the anal canal of a person. This can be injected through the anal canal. This is kind of an enema, Ayurvedic medicated enema. This will help you reduce your Vata dosha. So this is also known as one of the most important treatment for the control of Vata. So you can have this when you have pain due to excessive traveling or excessive physical activity. There are certain specialized type of enemas which can be used. This enema, the amount of enema can range from, there are different types of enemas. And depending on that, it can range from 30 ml to about 1.2 liters, 1 liter to 1.2 liters. So that's huge, but it has a huge medicated value. And as we say that the brain gut effect or the brain gut relation, Ayurveda understood this thousands of years ago, and the brain as well as the gut are always related to the Vata dosha. And so this Basti helps a lot to reduce such kind of pains due to Vata dosha. And there are different types of Basti or different types of enema for this. Then one of the things you can see in the picture, the another word Basti, which I said was, Basti actually also means something to store. So we also have different kind of walls made of corn flows, different type of flows, not exactly corn flow. It is a black gram flour, and we fill oil in that. I'll talk about that later as well. Maybe I have added that as well. Then there is a treatment which is trending at present. That is the Agnikarma. Many traditional doctors or many traditional practitioners in India used to do this. Not only in India, throughout the world, there were traditional practitioners or traditional healers who used to use this. I don't say that Ayurveda uses it as a traditional system, because Ayurveda has a lot of scientific things attached to this. This Agnikarma basically is applying direct heat or direct fire to the place of pain. What this will do is this will act as a counter irritant as well, and sometimes also as an anti-inflammatory. So when you apply directly this fire is applied with a metal rod which is made up of 5 metals generally, which is gold, silver, copper, iron, and tin. It is a combination of all these 5 metals, and that thing which you can see in the image with the small rod which is above the candle, that is used, and we directly apply on the site of pain. In extreme conditions, you can use this, because there are a lot of drawbacks, because people would say that, oh, I got burnt at that place, or that part of my skin got burnt and it doesn't look good. So usually people don't prefer it, but in cases of extreme pain, this is a very good condition, very good thing. It has a scientific thing as well. Many people are working on research on this as well, because this is showing very good results on the MRI for changing the degenerative changes as well. So that is one of the very important treatment therapies into Ayurveda. Then we have a very trending thing throughout the world. Everyone is talking, someone who knows about Ayurveda just wants to learn more about the Marma therapy. According to Ayurveda, the Marma therapy, there are about 107 Marma points in our body. These are extremely important points of the human body. And many of the points are very similar to the acupuncture points in the TCM, that is the traditional Chinese medicine. The TCM people manipulate these points to relieve many types of pain and many types of symptoms as well. The calf pain, a home remedy, which I have mentioned here, basically many people suffer from calf pain. If you have calf pain, exactly at the center of the calf, there's a triangular area. When you press that area, press it, release it, press it, release it. Do this for about 20 times. And you will see that your pain for your leg will be gone without even massaging the whole limb or the whole leg. This is basically these are Marma points, which according to Ayurveda should not be touched at all, because injury to these points can lead to permanent disability or severe pain. But you can use this under the supervision of someone who knows Marma therapy well. You can learn this, and this can be very helpful tool for relieving pain, especially certain kind of stiffness like in cervical spondylosis or cervical stiffness or the sternocleidomastoid muscle stiffness, it can be very useful.
So I just wanted to add that in Marma therapy, in Ayurveda, you don't really inject the needles as you would do in acupuncture, right?
Yes, exactly.
Right. So you're pressing the points.
Yes.
Sort of like an acupressure. What
Yes.
do you compare it to?
Actually, what they do in the traditional Chinese medicine, they have these similar kind of points. They use two therapies basically. One is the acupuncture where they insert the needles. Another one is the acupressure where they just apply pressure with some electric pens or certain different types of things, even with the hands. So in Ayurveda, the Marma therapy, what we do at present is the just mild to moderate pressure is applied with your thumb, which can help you relieve pain or stiffness in that part of the body.
Okay. Well, thank you for the clarification. So more details on the Basti that you mentioned earlier.
Yes. So this is the second type of Basti, or Vasate iti Basti. That means something which can store. So this is also known as Basti, but these are localized Bastis, you can say. This is something which developed over the time into Ayurveda. You can see that the wall of the wall that is made on the back of the female is made up of black gram flour because it is a sticky flour. It is mixed with water, made into flour, the way we make dough for Indian rotis or Indian breads. And then we put into some, excuse me, just a second. We just pour in some hot, warm medicated oil, which can be absorbed by the back or which can be absorbed by the muscles there, which can be absorbed into the body through that area. It is kept for some time. And then we keep on removing the oil and refilling it along with, because the temperature should also be maintained. So this is one of the treatments where we use this localized stuff. Localized oil is applied so that the oil stays there for some time. So here we can apply more amount of oil, and this is how it can help. This is the Kati Basti, what you are seeing here, which is especially for the waist. Many females suffer from backache, or in many conditions like lumbar spondylosis or disc prolapse. This can be a very effective treatment for pain management. Then this is the Janu Basti. The mode of action is similar. The oil is locally filled at the places of knee. And basically the knee, this can be also done only in conditions of osteoarthritis. I would not prefer, or I would not prescribe it to be done in the conditions of rheumatoid arthritis, because rheumatoid arthritis is a completely different thing, because according to Ayurveda, it is associated with harm or the undigested food, which we talked about. So this can be done into degenerative cases, and it is seen that it shows tremendous results even on X-rays and MRIs, that the degeneration is arrested, and even the space between the joints, which was reduced, increases, the pain goes away, the inflammation goes away, and the stiffness also goes away. People can walk absolutely normal if the therapy is done very properly, along with proper guidance, medicines, food and diet, and lifestyle changes. Then the Griva Basti, this is done over the neck. You can see the person is lying with the head down on the neck region. Similar application of Duff and warm oil. There are different medicated oil for different conditions, basically. And also depending on your arm, depending on your other symptoms, the oils are selected. And this is also something for your cervical spondylosis. It gives tremendous results for certain type of disc prolapse. Sometimes people have a lot of traveling, and then because of that, they have some disc changes, or you can say slip disc. In those conditions also, this is very important and very useful. Then there is a typical type of treatment known as the Rakta Mokshana. Rakta Mokshan basically means bloodletting. It is like removing the blood out from your body. So in this treatment, in certain areas of the body, it is generally done for the Pitta dosha or to purify the blood. But in cases where the Pitta is associated, the fire element is associated, and you have pain, there are different therapies, different types. One is where you directly cut the area and the blood is removed, the capillary blood is removed. Then there is cupping method where you prick the area and then you cup and suck the blood out. For this, we have two different things. Conch shells are used. Alabu, one thing which is named as Alabu, is used for this. Then there is the one which you can see in the picture is the leech therapy. We directly apply leech over the skin, over the area which is inflamed and which has pain, because this will remove the impure blood, and it up to certain extent relieves a lot of pain and inflammation, because the leech is believed to suck only the impure blood and it won't remove the pure blood. And there are methods to remove this leech, because once it gets stuck to your body, it's not easy to remove it. But with turmeric and things like that, we have ways to remove this leech. So that is the Rakta Mokshana, or the bloodletting.
I was going to add that it's got a lot of similarity. In acupuncture, they use the cupping and then use the cupping method to basically the same thing what you're talking about, the bloodletting concept. All right. So anything in conclusion that you would like to add?
So most important thing again here would be that you have to understand that pain is something which shows some kind of pathology. So do not ignore it. But on the other hand, because Western medicine, after a level, has certain side effects associated to it, the painkillers or the analgesics. There are certain conditions like diabetes or people with hypertension who cannot take painkillers, or people with kidney failures cannot take painkillers. And for those conditions, Ayurveda can be very important, and do consider Ayurveda. But please don't think for a magic pill or a magic treatment which can cure your pain with just a single pin like the modern medicine does. You have to make an equal effort as your doctor is making into Ayurveda. So you will have to change your diet. You will have to change your lifestyle according to your Ayurveda physician. And certainly you can deal with pain in much better, much effective way, and also deal with other symptoms in a holistic way through Ayurveda. Thank you so much.
So any questions? I see attendees for our Zoom webinar. I want to open it up for questions right now. So if there are any questions before we close, I'll give a moment.
Yes, would be wonderful if we have questions.
Sure. That's why I'm waiting if someone has questions, because I do see participants in our Zoom session. Well, one of the questions I had unless participants are thinking what questions to ask, is in COVID now, during the COVID corona situation, where we cannot go to an Ayurveda practitioner who can do Abhyanga and all the, all the therapies that you talked about, what would your advice be if someone is in pain, and what kind of medicated oil, maybe something they can buy off the shelf or something? Is there something you could talk about?
Yes, certainly. See, that's a very nice thing, because this is growing now. This is a part of our life, the new normal, right? So we have to understand that there are few therapies. The first thing, if I have to tell a normal person or a common person who is not a medical practitioner, if they want to deal with their pain, the first thing is check your own tongue. The first thing. If you are feeling stiffness, if you are feeling lethargy, if you are feeling like feverish, then don't go for the oil therapy. If you have ama or the white coated tongue, don't go for the oil therapy. If you have ama, then I'll give you a very simple thing. You can find sand near a beach or near the seashore. You can find sand gravels, right? Just take that sand home, try to make it dry, try to take it from a drier area, heat it on a pan, or you can microwave it as well. And then fill it in a cloth bag and directly apply to the pain area. Take care that you are not burning your skin too much. Apply there and then remove. Apply it and remove. This sand massage can be very important in conditions of rheumatoid arthritis as well, and in conditions where you have arm, that is the white coated tongue, and you have pain. So this sand massage will be very effective. Once again, like sand on a cloth, and through which the pain which you can, the heat which you can tolerate, you can apply it to the pain site, and that will relieve your pain. Now, if you don't have arm, you feel light, you are absolutely fine, and you are sure that only because your pain is only because of your Vata or only because of your degeneration. Like people who are above 65, above 70, they know that, okay, that is because of degeneration. During that condition, one of the safest oil to be used would be the sesame oil or the sesame oil. The way you pronounce it is okay. So it's like sesame oil or the sesame oil. Basically, this oil is one of the best oils to control Vata. So just take this oil, take it on your hands, rub it in the morning when you wake up. Take some about 50 ml of oil, take a bit on your hand, start massaging on your whole body from up to down. The movement should be upwards to downwards, because that is how you get nourishment. When you go from down to upwards or in opposite direction to your hair follicles, you are denourishing basically. So when you have an obesity condition and you are using dry powders to reduce your external fat or the superficial fat, you have to go in the opposite direction. There is another therapy, we can talk about that later. So I won't confuse you, but just remember, go from up to down, and for the joints, use it in a circular motion. Use this oil to massage your whole body, or just massage with the warm oil, warm sesame oil, warm coconut oil on your joints in a circular motion. You can do this for 5 minutes in the morning, at night time while sleeping, and this will, after 1 month, you will see this will help you with a lot of difficulties. Your stiffness, your movement would increase, your range of motion would increase, your pain would decrease.
Oh, that's, I think, very good tip. Any questions, final questions? I think, Dr. Dhanvantari, you're going to help increase the sales of sesame oil. No.
In India, it's quite common, so I don't know if it's a marketing thing.
Yeah, no, I'm just here. I think that everybody's after coconut oil for sure. You know, you see, everybody has discovered coconut oil, but sesame oil, not as much as coconut oil. So if there are no more questions, I think we are going to wrap up this session. Please let us know. Hope this session helped you. It has been a very informative session for me as personally. We want to continue to bring you educational sessions. We will bring Dr. Dhanvantari again on a completely different topic. Thank you so much for joining us today. We wish you a great day, and good night, Dr. Dhanvantari. And
thank you. Have a nice day, Amita. See you.
Thank you.
Bye-bye.
Bye-bye. Thank you. Bye-bye.